I have spent the last 40 years studying health the same way that Mark has spent the last 28 years studying economics. And I read every day all the experts around the world as they talk about what's going to happen with Medicare and what's going to happen with Medicaid and what's going to happen to the cost of health care overall. And I've been following this from a little bit of a different perspective, though, because I've been watching something called functional medicine. In the olden days, we called it natural medicine. We even called it orthomolecular medicine. Sometimes they call it alternative medicine. There's a lot of different names that it's been given over the years. But what I've noticed is more and more science has been coming into the play as far as natural medicine or functional medicine goes. So I'd like to regale you with a few little tidbits of information that you may not be aware of that will introduce us to this topic of functional medicine. Functional medicine is going to identify these diseases sooner. It's going to allow doctors to use nutrition and exercise and stress reduction to get these diseases under control or even prevent them. And this is going to lead to the long-term healthcare savings, healthcare cost savings that we really need. This is an interesting report done by Dr. David Eddy, reported in Business Week. He looked at everything the medical profession did, drugs and surgery and everything. He could only find scientific evidence to support 20 to 25% of what they did. That's why the headline, medical guesswork. Because 80% of what they're doing right now, they're guessing. There's no science behind it. And U.S. spends twice as much as other countries to get some of the worst health results of any country in the world. Over 95% of health dollars are spent on treatment, with only 5% on prevention. Over $100 billion was spent on angioplasty last year, and only 3% of patients are living longer with that much money being spent. And prescription drugs caused 700,000 emergency room visits last year and over 100,000 deaths. And the Institute of Medicine reports there's over 400,000 avoidable hospital deaths every year. Gary Null's book called Death by Medicine reported that the actual number of avoidable deaths was over 783,000 in 1 year. And the Journal of Clinical Evidence in Britain found that only 11% of conventional medical treatments actually produced a benefit. This is embarrassing, I think. It's embarrassing. British healthcare experts predict the U.S. will spend over 100% of their GNP on healthcare by the year 2065. On the other hand, the British medical journal Lancet Oncology study found that functional medicine was able to stop or reverse hypertension, obesity, heart disease, and prostate cancer. That was a big clinical study that they did. And the Institute of Medicine found that there was scientifically evidence to show that conventional treatments that had science behind them, combined with meditation, yoga, acupuncture, herbal medicine, proved to be both medically and cost-effective. And in this book alone, The Natural Pharmacy, there are 15,000 scientific references for functional medicine. Remember when I said conventional medicine only has science to support 20% of what they do? Functional medicine has 80%, has science behind 80% of what they do.